Hello, good morning, everyone. Welcome to our COVID-19 webinar series. This is episode 30 today. We're having reflections on our pandemic year as our theme to our final farewell episode. I'm Kristen Uhlenbrock. I am your host. I also work at the Institute for Science and Policy, and together with my colleagues at the Denver Museum of Nature and Science and our partners at the Colorado School of Public Health, we have been really excited to be bringing you this webinar series, and we're grateful for you joining us this morning. I do also want to offer our deepest appreciation to you as our audience who has been with us for almost a year following along with this series. You really have been instrumental in helping us shape this, everything from sending in your questions, providing us with ideas for topics, as well as sharing your feedback. So thank you very much for being our audience. We started this a year ago, as I alluded to, and I will have to say I am quite surprised that we are at episode 30. I don't think any of us had any expectations of how long or how deep or how rich we would continue on with this series. We've had almost 50 experts join us over this past year. We've covered topics, everything from vaccines to variants, from aerosols to the economics of this pandemic. We've talked about policy and ethics and technology and racism and inequity, as well as hearing guests really explain to us some of the science behind epidemiology and zoonotics and public health, and of course, but not anywhere the least, really impactful stories shared by so many of our guests. Over our past year, we have been dealt with this once in a lifetime science and policy challenge, and we are still living it. We have witnessed tremendous innovation as well as collective sacrifice. And through it all, we all have our own stories. So while today is going to be our final farewell episode, it's not goodbye forever. So it is a promise from myself and our Institute team and museum colleagues and partners at the School of Public Health that as major advancements or understanding or really high-level changes come about, that we will bring you bonus episodes. And so we will be back. So it's just farewell for now in this kind of regular cadence that we have, but a promise that we will bring you back with some future bonus episodes. It's my great pleasure to have a wonderful lineup of guests today joining us, including some of our past guests, as well as some new voices who are going to be talking a little bit about how this pandemic has really impact and shaped their lives, their work, their communities, and as well as any of their hopes that they have for the future. As our audience today, I want you to not ask us questions in that chat. I do want you to open it and engage with us in the chat, but we don't want to hear your questions. We have a lot of discussion. What we do want to hear today from you as our audience are your thoughts. Perhaps you have your own short story that you want to share with us in the chat. Perhaps there's an experience or a feeling or reflection that you want to provide to us. We want to see it, we want to read it, and we want to hear it. So please engage with us in the chat today in that way. Also, I'd say as our guests come on and provide some remarks, if there's something that one of our guests says that really resonates with you, let us know that as well too. All righty, I want to stop talking and bring on our first guest, which is a great pleasure and privilege to have joining us today, which is Bobby Lefibri, our Colorado Poet Laureate. Bobby is an award-winning writer, performer, and cultural worker, fusing a non-traditional, multi-hyphenated professional identity to imagine new realities, empower communities, advance arts and culture, and serve as an agent of transformation, equity, and social change. His list of accomplishments and awards and impact is beyond impressive, in my opinion. And in 2019, Governor Polis has named Bobby our Colorado's 8th Poet Laureate, making him both the youngest and the first ever person of color to be appointed to this position. We are grateful that he's joining us this morning to open our final farewell episode. Good morning, Bobby. How are you doing?
Good morning. Good morning. I'm doing really well. Thank you so much for having me. I'm always grateful as a poet and as poet laureate when art and poetry in particular is invited in and centered in conversations and utilized as an entry point to these important conversations, right? It's important, I believe, to have artists and dreamers and philosophers and imaginers at the forefront of helping us contextualize the human experience and what we're sort of going through collectively, and to really help design, what our future might look like. So I'm going to share some poems. I did a lot of writing last year. As a poet, there was so much happening, and that's part of what we do is we try to translate what is going on in our collective consciousness so that we may connect through these words. So the following is about 20 minutes that I've prepared of poems that kind of span the way I was feeling through the pandemic. And, as we wrap up with this series, I think that this is a good bookend for me as well. This is the first poem I wrote right when things were really starting to ramp up. We were really starting to panic. This is simply called COVID-19. The sirens are sounding. The screams are loud. The virus has packed its bags. World traveler without a passport. Borders are man-made. Walls cannot contain life on the move, but that's another story. Asian businesses were empty before streets. Racism. The toilet paper is gone. Panic begets panic. My 3 p.m. meeting is now a Zoom conference. Tom Hanks is raising his hand. Let's talk about the poor. 30 million uninsured, ends meet public transportation to get there. Self-quarantine, privilege, paradox. Blue collars can't work remotely. Hourly wages, side-eye the salaried. Go ahead and cancel school. Childcare is a killer too. Industrialized without a heart, developed without a conscience. Capitalism gaslights, blames our bodies instead of broken systems. Wash your hands, cough into your sleeve. Plutocracy lampooning universal health care. Call on your God or whatever. Just don't touch your face if you make the sign of the cross. And then we started talking, right? We started having these conversations about who was considered essential. And we watched these people, go back to work. And, these are people that I know who were kind of forced with this idea of like, I have to do this, but I don't want to do this, but I have to do this, right? So one day I was thinking about the folks that we have deemed essential workers in all of that complexity. And I wrote this for them. And together we watched it happen. Watched the stars come out at night. There, right before our eyes, a grand reveal. And the stars, the people, they did what they always do. They got up, they packed their lunch, they clocked in, they delivered their bodies, they took orders, they didn't complain, they were grateful. They smiled, they cashed their checks, they paid their bills, they were broke again. They prayed, they stretched, they made miracles, they raised children, they dreamed in grocery stores, in fields, in janitors' closets, in restaurants, in shelters, in classrooms, factories, and banks, and offices, warehouses, buses, trucks, trains, some in emergency rooms, and clinics, and morgues, and mortuaries. They worked because rent, because food, because bills, because insurance, because integrity, because hearts, because someone has to make the money for those at the top who don't really make it themselves. Mid-pandemic, I was home a lot. I had the privilege of doing all of the things that I do from home. And one thing that I took up more saliently than years past was gardening, right? And I think we were doing any little thing to find joy. And I wrote this poem the first time I saw something sprout up in my garden, because sometimes that's what poetry is. A blade of green has found its way out of the womb of the earth. Sometime between the moon and morning, between rain and sun, the maíz announced itself to the world. I didn't see the exact moment it happened. Perhaps this is how all new beginnings commence. Some action of yesterday midwifing tomorrow. It entered this world unannounced, almost in secret, unfolding to the music of the crickets choiring. It doesn't look like corn yet, but I formed a rose with my hands, dropped the seeds where the emerald needle stands. This is what it means to believe in promises, to hang your heart on hope, to taste the future before it is here. I think so much of last year required us to find the extraordinary in the mundane. And that's the beauty of poetry, I think, sometimes, is we're able to connect these very large ideas and concepts with these very simple things that we experience every day. One Saturday I was bored, and over coffee I wrote a sonnet. This is a sonnet for Saturday. We are 4 months into a pandemic. I match my mask with my clothes to stay fresh. It's July 18th. There's still fireworks. The boom echoes like a stark cry for help. I haven't dapped anyone up since March. Uncertainty is a song on repeat. Our hearts are hopeful and broken and glum. Everything is on fire. We are flames. Forget not that you are mostly water, a river carving itself into the earth. Forget not that you are a miracle, a perfect harmony of bone and flesh. Perhaps we're en route to utopia. Perhaps we'll just get lost along the way. I found myself asking a lot of questions, and as a poet, as somebody who uses language to try to language the unlanguageable, folks relied on these things sometimes. And it was wonderful to hear that people were finding some sort of comfort in the things that we and my friends and artists were sharing. One thing we all did, I think, was we were peeled to the news, right? And one time I read this beautiful headline, and like any poet, you take those things and you make something out of it. So this headline, quote, "When the San Francisco Bay Area locked down, urban noise levels plummeted. In response, the white-crowned sparrow changed its tune." So I read that headline and it just sort of like, there were so many things in that. And I wrote this: "I can only imagine how beautiful our songs will be. There in that imaginary place where all is calm, where we don't have to shout to be seen. How beautiful it will be to mold our mouths into instruments of joy, rage and weariness, a distant memory. When the noise dies, the borders and the badges and the systems and the structures will be buried too. Then listen to us sing, listen to us sing, listen to us sing." I had an encounter at a grocery store with an acquaintance I hadn't seen in a very long time. Still peak pandemic, when people wouldn't even want to walk next to you in the aisle at the grocery store and everything was strange and awkward. It's still that way to some degree. But I wrote this after seeing them. I think the default answer when people ask us how we are, we say good, even if we're not good. And that's the concept of this. Today is an ending. A goodbye, a death, a despedida. The credits are rolling, the audience is leaving, but no one seems to know where they are headed. The sun came up today, but couldn't tell you why. When you ask the acquaintance you run into at the grocery store how they are doing, their voice will raise 3 octaves and say, "Good." Your voice will raise 3 octaves and repeat the lie. There may be good days, but we collectively are not good. The earth is shedding her skin. Democracy's ribs are showing. Hope and fear play tug of war inside of us. Uncertainty is a vulture circling overhead. But if today is an ending, tomorrow is a beginning. A greeting, a birth, a llegada. Tomorrow is a promise in the distance, beckoning us to find our way home. Last year for me was really tough. I travel a lot. For work, for arts, for culture. And so I understood that it was probably going to be a minute before I traveled. And so I woke up one morning, these darn Facebook memories and Instagram memories, they show you where you were a year ago, prior. And I was looking at, these amazing photos and of me outside the country. And I just had that longing in the question as to when I'd be able to hop on a plane and go somewhere new again. So I wrote one really long sentence about that. I can't wait to wake up in the arms of a city I don't know and stumble into a cafe and eat whatever they offer for breakfast and smile at a pretty girl who speaks a language I don't understand and introduce my eyes to sights unfamiliar and take photos of things I want to remember forever and talk with someone about what it means to exist there and listen to music billowing from a building that looks nothing like home and write love poems to the landscape and figure out how to give more than I take and sip on whatever it is they drink there and put my feet in the water or my hands in the soil and connect with the art makers and hop in a car or board a train or mount myself on some animal and just be and go wherever the wind commands, because we are all just dust anyway and the world is big and there is so much to see. Another day, I remember this was late spring, but we still had snow, I remember. And this was these were the days where the streets were actually very quiet. I live on a pretty busy thoroughfare, but I just remember how sometimes it was so quiet and nobody was out. And for a moment, I felt a sense of peace. I felt this kind of overwhelming feeling that the stress was gone for a brief moment, and I wanted to capture that feeling. And I wrote this poem. It's called Nothing Left. And when there is nothing left to do but live, let us retire the noise and build a home inside the stillness. Grab a wrench and unfasten the parts of you that have become mechanical. Rest your weary limbs in the bed of anomaly. Outside, the machine is powering down. You can hear the birds when the gears aren't grinding. When there is nothing left to do but live, make a vacation of your body. Each part explored a stamp on your passport. Begin with your heart, maybe. Crawl inside and sightsee. Ask difficult questions about who it is and why. Outside, the machine is powering down. You can hear yourself when the gears aren't grinding. When there is nothing left to do but live, simply show up. That has always been enough. And together, in this sudden strangeness, radical imagination will run wild. Tomorrow, being built today. I did get a chance to travel once internationally last year for a project I was working on in Oaxaca. And if you know anything about Oaxaca during Dia de los Muertos, it's the most beautiful ceremonial indigenous celebration, mocking, and parade of death. And it was very amazing to be in that space during this time. Although their festivities were completely canceled for the most part due to the virus, there was still this quiet air of spirit that existed there. It's probably my favorite city in the world. I've traveled a lot of places, and very few places feel like Oaxaca does to me. But I wrote this goodbye to 2020 there. I was on this beautiful balcony of a colonial structure, drinking mezcal, and just sort of watching the world go by, and really wanting to release myself of the heaviness that we've all carried. And I wrote this poem. 2020, it is here I leave you, in this Campo Santo, en esta tierra sagrada, in the midnight of the maguey. It is here I leave you, where the calacas dance and the guitarra cries and a mockery is made of mortal things. It is here I leave you, standing atop the cobblestone, en mis manos una vela encendida, brazos llenos de flores. It is here I leave you, mezcal a my breath, agua bendita goteando de mis ojos, sonrisa en mi cara. It is here I leave you, dressed in all black, cempasúchil derramando de mi boca, oraciones convocando mañana. It is here I leave you, singing this sad goodbye. I will not look for you where you no longer are. It is here I leave you, bajo el cielo infinito. Todo tiene su momento, todo tiene su fin. Everything has its moment, everything has its end. It is here I leave you, where the altars are dressed and the papel picado sways, las estrellas nuestros testigos. It is here I leave you, hands converted to shovels, digging this grave. Soon grass will grow over the scar left in the earth. It is here I leave you, these words an epitaph, copal rising like a spirit, el viento, a pallbearer carrying you away. It is here I leave you, Zapotec moon shining, bridges set afire, ceremony spilling from the streets. It is here I leave you, to join the parade of other things that are expired. Hasta nunca jamás, hasta entonces. This last poem I'm going to share with you all, I recently read for the Biennial of the Americas. They commissioned me to write a poem about mourning, social memory, monuments, and how we memorialize, the folks we've lost, and create a better idea of where we want to be in the future in regard to this thing we've all been through. This also marked the last poem that I would write about the pandemic. As an artist, as a cultural worker, as a creative, sometimes we can get stuck in these things, especially when they're salient, right? And so for me, I also wanted this to serve as sort of a bookend of sorts. This is my last poem, and its title is Here Where We Are the Flowers. One day, the globe is spinning. We are smiling or not. Mundane or magic normalcy walks on 2 feet. Autopilot guides our way. Things are the way we know them to be. New lovers braid their fingers together for the first time. The Zócalo is full. The mercado is loud and abundant. The city is a body living and breathing. We go about our day. The cumpleañera blows out her birthday candles. We hug our grandmothers with reckless abandon. Every seat at the dinner table is full of friends and family. We are laughing, mouths flung open, words unapologetically traveling upon the wind. Vivacity abounds. The next day, the globe stops. Together, we furrow our brow, stumble off kilter. Our hearts become ticking time bombs. Panic begets panic. All of us running in place. The unknown tethers itself to our collective consciousness, our psyche, a lone wolf howling at the moon. We retreat, replace wings with worry, trade the social for the solitary, make an enemy of touch. Distance becomes our god. 6 feet apart, running away from 6 feet under. We forget how to look each other in the eye. Survival becomes a dreary song we play on repeat, our hands chapped from reading one too many headlines. Then slowly together, we attempt to construct a new language, knowing words like our leaders are failing us. We begin to speak in statistics, but here the numbers are lives, the percentages are people. Meanwhile, the curve is rising, the crescendo, a destination uncharted. The corporeal try and coax their jettisoned souls back into their bodies, and there are so many bodies. Blood, bones, flesh, wrinkles, birthmarks, tattoos, dimples, eyes, scars. Existence is upended, a hemisphere uprooted, the earth confused by all the graves here where land is acknowledged but never returned. Grief morphing into trauma, collective mourning, curses shouted toward the heavens, candles lit where life should be. How did we become bygone? We've all lost something, found ourselves digging for unknown things in places we have never been, territory uncharted, jutting emotions, a compass pointing in the direction we have never traversed, anguish operationalized, but they who have a why to live can bear almost anyhow. So let us return to the circle, this holy hoop of hope that is unending. Let us lick each other's wounds, offer one another the medicine of mutual aid. Let our mourning morph into ritual. Let our grief be a tender mercy. Let these tears be libation. Let us become the altar, something living, something unfixed, something capable of transforming. Let us be both the memory and the imagination, the stewards of bridging yesterday to tomorrow. Let us remember so that we never forget. And here at this monument, this memorial embodied, we will learn to harness and activate our anger, channel and transform our anxiety. Here, we will exist unafraid to sit in our sadness, to allow for it to fester until it transmutes into healing. Let our bruises become a balm. Let our gaping wounds become mouths that translate the pain. It is okay to not be okay. Let us bathe in our brokenness, evolve in our emptiness, keeping faith forward facing. And in this place we see but have yet to arrive upon, let us create new meaning, social reconstruction in our hands here at this human memorial, at this monument in the flesh where we are the flowers, where we are the prayers. Let us say and remember their names. Let us shout our own into the void so loudly that the unborn waiting somewhere in the cosmos will smile celestially and proud, and we will walk together across time and space with understanding and empathy, arms linked together, experience endured, healing and heard, and we will bend into tomorrow with promise. I promise. Thank you.
That was very powerful, Bobby. Beautiful. I'm absolutely speechless. I think the phrase you said is language for the unlanguageable. Absolutely wonderful. Thank you so much for joining us. Thank you for capturing these emotions and experiences that so many of us have struggled to find the words for. I really appreciate your time today. All righty. I saw our chat had a lot of great words for you, Bobby. We're really thankful that you were able to kick off our final episode. I appreciated your words about bookending your poetry around the pandemic. We are bookending our series as well. And so a great kickoff. I'm going to bring in our next guest to this conversation. And for those of you who are asking, of course, yes, we have a recording of this and Bobby's remarks, and that will be made available immediately afterwards on YouTube. So we'll be sure to share that out. Thank you, Bobby, very much. Okay. Our next guest up for today is Rachel Herlihy. Rachel is our state epidemiologist here in Colorado. She works at the Colorado Department of Public Health and the Environment, as well as serving as a preventative medicine physician. She's been with CDPHE since 2011. Dr. Herlihy has been leading our state's COVID-19 surveillance, case investigation, and outbreak response. The weight on her shoulders must be tremendous. If you all joined us last summer, I think it was in June, we had Rachel on to share with us a little bit about the summer of COVID-19 and what to look out ahead. And here we are, almost a year later, in essence, definitely summer on the horizon for many of us. So good morning, Rachel. How are you doing today?
Good morning. Thank you so much for this opportunity to be here. And I think I want to first say thank you to Bobby also. That was really touching for me personally. And I think his words probably spoke to all of us differently. And as we get further into my remarks, I want to talk about a place where I sort of felt particularly touched by his words. So Bobby, I'm so grateful for you and your words at this time. I think, what you shared with us today, I think are the words and feelings that we've all been trying to express. And I think not nearly as eloquently, I think, as you are able to. So grateful for you, but I have to say I'm not so grateful to follow you right now. So we'll see what I can do to follow. So I think the first thing I want to say is that I'm just so grateful at this point that it is April of 2021, not April of 2020. It has been an incredibly difficult year for me personally, for public health in general, but for obviously all of Colorado. And this is the part that I think touched me in what Bobby said is, the tremendous loss of life that we've experienced in this last year. And Bobby mentioned statistics, and I feel like I'm sort of personally the stats keeper and reporter. And so I, at different moments in time, feel those stats and don't feel those stats, and think about them and don't think about them because of the weight of them and the impact of them, and recognizing that, as I tally the cases and hospitalizations and deaths, that's really human suffering. And I think at moments in time, I've forgotten and remembered that, and felt tremendous weight when remembering, and felt guilty when not remembering the suffering that's sort of behind some of those stats. But we've also all had lots of economic and financial losses. As Bobby mentioned, the absence of celebrations, connection, travel, leisure in our lives, and the impact that has had on us. And so like everyone, I'm really so eager for a longer term return to normal, growth and prosperity in Colorado, healing and some unity that comes in that healing and acknowledgement together of what we have been through, and also what we have accomplished together, and hoping that that sense of unity and healing and acknowledgement of what we've been through can really bring us closer together, and bring all Coloradans closer together, and be for all Coloradans. But, in the near future, I recognize that we still have a lot of work to do. We've come a long way. We've learned so much about this virus. We've learned how it's transmitted, who is most impacted, what stops it. We've learned the important role of masks, and who knew that masks would become so political. But we've learned the science behind masks, and that's really been an important accomplishment. We've built an incredible public health workforce, and I think that will be a lasting impact. We've used technology in new ways, new testing tools in the laboratory, epidemiologic tools for contact tracing, things like this exposure notification app we've been using. But of course, most importantly, we now have these safe and effective vaccines, more effective than we ever imagined they would be. And they're really an incredible testament to scientific progress that has come with this pandemic. We had this mRNA vaccine technology that was sort of sitting on the shelf waiting for a use case, and it really found a pretty incredible one. So here in Colorado, just some stats, because that's what I do. 80% of people over the age of 70 have received at least one dose of that vaccine. More than 1 million Coloradans are fully immunized now. Nearly 2 million have received at least one dose. And at this point, we're vaccinating about 300,000 people per week in the state. So that's obviously an incredible accomplishment, and so much hope comes with that. But also what comes with that and makes me feel hopeful is the fact that we really get to keep all of that progress that we've made, the knowledge we've gained, the workforce we've trained, the rapid advancements in technology that we've gained are really all things that we get to take with us. So public health has really taken giant steps forward. And I think at least I am now personally just starting to look up and realize that. And I'm feeling, really relieved right now to know that I think epidemiology is going to look different post-COVID-19. It feels really nice to know that people not only know how to pronounce epidemiology now, but actually know what it is and understand what it is. And I think that says a lot. But of course, lots of work still to do. A colleague of mine has compared our current position as the eastbound stretch of I-70 after Floyd Hill, where the signs to truckers say, don't be fooled, you're not down yet, steep grade and sharp turns still ahead. And I think that's really where we are right now. So with the vaccine rollout, we're really racing against these new, more transmissible or more severe variants. Including some of those variants that we know could be a setback for vaccines. They're more likely to escape our immune response, cause reinfection, decrease vaccine effectiveness. And unfortunately, like a number of other states, Colorado now looks like it could be entering this fourth wave. So again, we have a way to go. Cases are increasing, percent positivity is increasing, hospitalizations are all on the rise right now. And we're seeing clear protection in vaccinated populations, but we're not anywhere close to herd immunity yet. And again, that's playing out in the numbers that we're seeing. And so, at least for the short term, while I'm feeling very hopeful about the longer term, at least in the short term, we really need endurance in this final stretch. We've come so far. And for just a little bit longer, we need people to continue to wear masks, continue to stay home if you're sick or you've been exposed, keep the social distancing, wash your hands, get your vaccine as soon as you can. And then as far as vaccine goes, find trusted information about the vaccine if you have questions, and tell other people why you chose to be vaccinated, and tell them about your belief in science and the importance of vaccine in getting out of this pandemic. Thanks.
Thanks, Rachel. Huge thank you for your service. Yeah, that was a tough act to follow, but that was wonderful. Your words were special and meaningful. So thank you for that. If I can ask you a question or a couple questions here, real quick. Have you been vaccinated?
Yes, I have. Yeah, I'm a proud vaccine card carrier. I've had my second dose, and yeah, feeling confident in that and hopeful in that.
Anything you're looking forward to for this summer personally for you once friends, family, and others around you get vaccinated as well?
Yeah, I too love to travel and have missed that and missed time for adventures with my family. Miss seeing my father who's in his 70s. So I think those are all things that I'm really looking forward to, is spending time with family and friends again and having some time for adventures.
Yeah, I can see hugs on the horizon with family.
Yes.
For myself. So Rachel, thank you so much for your leadership. Thank you for joining us today. Thank you for joining us last summer. Thank you for leading us through this pandemic. I absolutely appreciate the positive note that we all kind of see with the light on the horizon, with the dose of cautiousness and patience that we all need to take as we continue to, make sure we get this pandemic under control. So thank you.
Thank you.
Great. All righty. Up next is Dr. Cerise Hunt. Cerise is also a previous guest of ours. Dr. Hunt is the director for the Center for Public Health Practice, assistant professor in the Department of Community and Behavioral Health at the Colorado School of Public Health, and past president of the past president of the Colorado Public Health Association. Cerise was instrumental in the formation of the Colorado Black Health Collaborative, among other achievements. She has tremendous leadership working on diversity, equity, inclusion, and organizational change, including health equity, racial and ethnic health disparities, and community outreach and mobilization. She joined us last summer and was really valuable in helping us put together a two-part series for this that was focused on race inequality and COVID-19, including being one of our guests, as well as thinking through some of our other guests. I'm really grateful that Cerise is joining us back here this morning. Good morning. How are you doing?
Good morning, Kristen. I am doing well. How are you? I'm glad to be back, to get called back. So that's cool. I mean, I wish I had more great things to share, but I'm glad to be here and participate in this great discussion.
Great. I'm doing okay too. I'm a little bittersweet. I'm optimistic, for the road ahead and cautious, but also bittersweet that this is our last episode. But it's, I have to say, extremely powerful so far. So Cerise, why don't you share with us a little bit about how far we've come and what are your desires for the future?
Okay, well, thank you. And so, as I appreciate this question, because when I think back, of how far we've come, since last year, unfortunately, we have not come far at all. And to me, it's very disheartening and frustrating because I think we can do better. And COVID-19 has illuminated the systemic inequities that have disproportionately impacted people of colors for centuries. So when I think about how far we come, I have to go back to the historical aspect, museum folks, history, and we have a history and current reality of racism and discrimination across the United States in Colorado. And these inequities result from systemic, avoidable, and unjust social and economic policies and practices that create barriers to opportunity, which this COVID-19 series has revealed. We've had those discussions, we've had those talks. So I appreciate this space of learning and utilizing your resources to really shed light and to be a voice so we can make change. And so my desire is for decision makers, leaders, and all of us here, all of us in this space, this virtual space, that we do the work required to dismantle structural racism. And, Kristen, I'm often asked, well, why do you focus on racism? And because it intersects and reinforces a broader set of isms by people who experience structural and interpersonal discrimination. And these are along the lines of gender identity, class, and geographic region. So each type of discrimination merits undoing in its own right, but an intentional focus on racism will give individuals and organizations, because I won't say individuals, each of us has a role in dismantling racism. And each of us has a part to play, and that's all of us. So I want to make sure I stress this. So I'm going to say individuals and organizations, because like I said, I think I said last time, we like to point our finger at the system and forget that we make up the system. And so I really think that, so when we intentionally focus on racism, we give individuals and organizations ways of approaching issues that will serve them in working against other forms of systemic injustice. And so what I'm going to do, Kristen, if you don't mind, is I'm going to use like a social ecological approach to explain my desire. So what my desire is, because I am still hopeful. I appreciate what Rachel said about, healing and coming together, but we all have to do our part in order for this to occur. We all have to think strategically, well, what's my role? And I'm going to use a social ecological approach to really explain how I feel like we can dismantle structural racism. And like I said, the collective we is all of us. At an individual level, we need to apply all the learnings about anti-racism. I hear folks that are reading anti-racism, white fragility, implicit bias, all these learnings around equity and justice, all that we've learned this webinar series, and take all of this capacity building and translate it into our practice to really build it into action. We must constantly reflect on our own practice to ensure we aren't causing harm or oppressing individuals we claim to serve. So really that interrogation of your own practice, implicit bias, doing the work constantly, not the one and done. I read the book and put it on the shelf. I read the book and thought about, how does this inform my policies, practice, and procedures? How can I apply this to my day-to-day work? So that's the action. At an organizational level, we must dismantle the structures within our own organizations that perpetuate inequities. And so we all talked about dismantling structural racism, but if we're not watchful, we can rebuild through the same lens. And so we have to shift our thinking and shift our lens, because we can't do business the same as usual. So we have to examine our policies, examine our procedures, and really look at that equity focus, looks at who's benefiting from our services and who's not, And when we know that folks aren't benefiting from our service, so like if we know groups of color, if we know community colors aren't getting the vaccine, we need to stop and pause and ask why aren't these groups? Oh, and then we might see we didn't have locations in their community for the vaccine. So we have to think strategically about who we are engaging, how are we engaging with folks, who's benefiting and who's not, and to ensure that, like I said, our unintended actions can have a tremendous impact and can be perpetuating inequities. So really identifying how racism is operating within your organizational structures. And then at a society level, so we look at the individual, we're looking at the organization. At a society and policy level, we need to apply a multi-systemic approach for dismantling and rebuilding. So it's all of our systems working together, because I think about our educational system, K through 12 and higher ed, healthcare, public health, all of our government systems, local, state, that, housing, justice, behavioral health, environmental health, employment systems, we all have to work together. And that's why I appreciate those health in all policies, but we need to have equity in all policies, where we're really thinking of how do we promote justice within our systems? Where have we fall behind the gaps? Because it's the same communities, it's the same people that are being disproportionately impacted. And then also these systems need to be working together to devise a COVID-19 recovery plan. That's the only way we're going to heal. We have to be intentional. A plan that's really going to look at the educational gaps, those achievement gaps due to remote learning and accessibility. We need to address those concerns right now. Folks have lost their jobs. So how are we going to rebuild? And it's not just we're going to give out funds and we got to rebuild our communities, ensuring that the folks that are in isolation, folks are getting the behavioral health services that they need on the ground. So that's what's really going to take. So we need a whole recovery plan of how we're going to recover. So it's ensuring that we are being proactive. So to sum up, Kristen, we just got to be willing to do the work. And that's what's needed, all of us, and taking up our own, knowing what we need to do individually to dismantle structural racism. Thank you.
Wow, thank you, Cerise. Very well said, very action-oriented. I really appreciate that. You covered so much ground right there, and it is all of us, and we all have to do this day in and day out. It isn't just the readings, it isn't just that lip service, it is true change. And so thank you for joining us and sharing that. I really liked what you said with, we need to ask why, you know what I mean? There's a lot of assumptions, I think, sometimes that people will come in and just assume, right? Whether that's, why is someone not taking the vaccine? Why is this community not receptive to a vaccine? And so asking why is really powerful.
Yeah, and if I could jump on that real quick, I appreciate that, because that why is going to tell you that there is a history of mistrust. You know what I'm saying? That people aren't trusting the systems that are saying we need to come and get these services. And it's not, and it's not trust. It goes beyond just Tuskegee. It's about current mistrust based on how people aren't being treated fairly within our health systems. Yep. And being treated in any of our systems. So yeah, history plays a component, but there's current injustice where people feel like I'm not being heard. I try to access, or unaware of accessibility. So I appreciate you saying that. So when we talk about vaccine hesitancy, if our conversation isn't looking at why folks in our systems do not trust us and what do we need to dismantle that issue and address those concerns, we'll be faced with this from time and time again. We can no longer ignore the issues, the inequities, and the racism within our systems.
Thank you. Well said. Mm-hmm. Yep, that trust is vital. I appreciate you, Cerise. Thank you for joining us again. Very, very great words here. Okay, our next guest is Tracy Priebe. I'm so thrilled to have Tracy joining us back here today. Tracy is a charge nurse in the medical ICU at the University of Colorado Hospital, where she oversees the daily functioning of the unit. She's been working at the hospital since 2013. Her work focuses on patient-centered results, as well as supervising and mentoring staff. She was one of our earlier guests last year. She joined us, I think, for episode 4. And it feels like a lifetime ago through my lens. I can only imagine, Tracy, how long it has felt through your perspective. Thank you, first of all, for all that you do and all of your coworkers, particularly those who have worked really on the front lines in our ICU units, trying to save people's lives from this pandemic. How are you faring since we last spoke, which has been almost a year?
Well, good morning, and thank you for allowing me to join and speak with you all again. So, wow, what a loaded question. I think I can speak for my colleagues and I that a lot has changed this last year since we've spoken. And I would say overall, we're doing a lot better. And I'd say a lot better in the sense that we have found our new normal. We have developed and discovered a type of strength and resiliency that I think a lot of us knew that we never had. But we've made so many advancements as well. So scientifically, we learned so much medically about the disease process, about the most effective treatments, about the best supportive care for COVID, and about what to expect when a patient presents. So I think that has helped us to give a more holistic care to these patients. And we've also improved exponentially in efficiency and safety. And I would say that safety for our patients, for their loved ones, for the community in general, and for ourselves. So we're still continuing to see these waves and these spikes, but feel that we can handle them in a much better way than we could a year ago at this time. So, of course, some of the challenges still remained. I'd say one of the most difficult things that we're still seeing here in the hospital goes around our visitors and the visitor restrictions. And that's not only for the COVID patients, but for all patients here in the hospital. We know it's for the best, it's for the community at large, and it's very important that we are restricting the ins and outs of the hospital, but it's hard to watch patients and their loved ones have to communicate virtually, and hard to watch loved ones try to support their families or support their patients as they're trying to fight this virus on their own. They're not on their own. Us as healthcare workers are here right by their side every step of the way, but it's just not the same as having your loved one there in person. That being said, our hospital has started as a trial, and it was so successful and impactful that we kind of have a new visitor policy with our COVID patients where we are allowing a visitor in. And that is quite rare to find throughout a lot of hospitals and systems in the nation, but we have gotten such great feedback. And I think, that can help as far as physical healing, psychological healing, emotional healing, and that's for the patients and for us. So I think it's a win-win situation. We have the adequate PPE, where before a year ago at this time, that was a huge concern. We have the PPE and the safety equipment we need to keep everyone safe. And so that's a really neat thing that we have implemented. Regarding hopes and desires for the future. So one of my biggest hopes is that not only for my colleagues, I can speak for the general public, but my colleagues in particular who I see every day, that we will continue to seek and utilize resources that allow us to continue impacting lives for years to come. It's been a traumatic year for multiple people in many, many ways, but being on the front line, there's a lot of trauma and PTSD that I think has developed, and that does worry me moving forward for healthcare workers. These feelings of burnout and despair, hopelessness. On the other side, there, again, we've seen a type of resilience and strength I didn't know we have. Seeing the teamwork, the hope, the compassion moving forward. So lots of feelings, good and bad, but I hope that people will utilize the resources that are available for our psychological and emotional well-being. I also really hope that people will just trust us and trust medicine to protect themselves and their loved ones. With the vaccine being very, very available at this time, I just want to encourage people to, seek out resources that help them feel as like they know what they are getting, but it is safe. It's safe and it is so effective. Let's see. I hope also that people have learned to take this and other illnesses seriously. This is this is not something to take lightly. Life is so extremely fragile, and too often people take it for granted. The importance of telling your loved ones how you feel has, I think that has become more and more important, and hopefully people are more and more aware of that. Also, the importance of having an advance directive and a living will, so that your loved ones can help you to help honor your wishes. That's one thing, even prior to COVID, that we ran into a lot, but especially with COVID, we have seen that when people don't have those advanced directives and living will, that families do not have as much guidance as far as what they think their loved one would like. So that's something that I would highly recommend. And then just how physical, mental, emotional health all go hand in hand. So to watch out for yourself and your loved ones and the community at large in every way. It's not just physical health, but it's psychological health, it's emotional health, it's spiritual health. And so again, seek those resources, check in on your loved one, check in on others, and live every day like it could be your last, because some of these people come in thinking they have, a cough or a cold, and they are never allowed to leave. So thank you again. And yeah, if there's any questions, let me know.
Thank you, Tracy. I appreciate that. I actually appreciate some of this very practical advice that we haven't talked about here, right? About advanced directives and wills, and a huge thank you. I will say, and I don't know if our audience remembers your episode from last week. You have literally been on my mind since we met and spoke last year. I know you were going through a lot personally, not only professionally, but in your personal life. So how are you feeling right now? Are you doing okay? Are you a little optimistic for the summer? I know you've had to deal with a lot this past year.
I feel so supported. I feel so cared for. I feel valued. And I feel like I have made a difference this last year. And that has been my goal ever since I was a little girl. Like, how can I impact this world? How can I make a difference? How can I make my parents proud? And I feel like I've done that. And the gratitude and respect that people have shown myself and my colleagues and healthcare workers in general, that's not the reason we do it, but it helps us to be better and to do better and to be optimistic for the future. And so that has been very impactful, and that has motivated me even in the times when I don't know if I can make it on for another shift in another day, and my heart just feels broken by everything I'm seeing. It gives me hope, and I know that we're going to be okay. Personally, again, as you stated, I've been dealing with a lot this last year. For those of you who don't know, my father, in the midst of all this, was diagnosed and fought with terminal cancer, and he passed a few weeks ago. And trying to deal with that situation, as well as professionally in the hospital in the ICU with all this COVID stuff, it was a very tough year. But I think I can move forward with this knowing that I did my best, that I was able to support my family and my father in his final moments, travel back and forth in a safe manner as much as I could, and then again make an impact here. I'm proud of myself. I'm proud of my colleagues. I'm proud of my leadership, and I'm proud of us as a community for the progress that we've made.
Thank you. I'm very grateful for you. Thank you for joining us today. Thank you for everything that you've been doing, your leadership, your coaching, your personal challenges, and sticking with it. It is very, very important. And thank you for joining myself and sharing with our audience today a little bit about that experience and what y'all are dealing with. I'm very grateful for you. Thank you.
It's my pleasure. Thank you.
Thanks, Tracy. All righty, guests, we are coming up into our final few remarks here. These two folks joining me right now need little to no introduction. I'm very thrilled to have, of course, Dr. John Samet, who's the Dean of the Colorado School of Public Health, as well as leading our state in a lot of our epidemiological modeling. So many other wonderful things to say about John, but I do just want to say, he's been the utmost, most generous, involved, wonderful colleague and partner for this series. We could not have even done this at all without John and the School of Public Health. Good morning, John. How are you doing today?
Hi, Tracy. Doing great, and it's been a remarkable series of presentations and discussions this morning.
Thank you. And of course, those of you on probably know this other gentleman I'm getting ready to introduce, which is George Sparks. George is our president and CEO of the Denver Museum of Nature and Science. He also founded the Institute for Science and Policy and is my boss and leader and inspiration many days of the week. I'm so glad that George was able to join us today too. George, how are you doing this morning?
Kristen, this has been a lot more emotional than I thought it would be. I mean, it's been a really emotional year period, but this has to be one of the more emotional experiences that I've had over the past year anyway, in a very positive way.
Yeah, same here. So George and John, I want to give you all the floor for a little bit. I think we may have mentioned this at some point, but of course it was the two of you knowing each other and having that conversation when this pandemic was happening that kind of led to this series. But we don't need to talk about the initiation of where we are. I want you both to maybe just share a little bit about, you woke up this morning, what's on your mind regarding the pandemic and what we've lived through so far in this past year. John, why don't I start with you, and then George, please chime into the conversation.
Okay, well, I think I wake up most days thinking about some part of the pandemic. I will say that if I had chosen a moment to be a dean, I might not have, School of Public Health, I might not have picked one while a pandemic was in progress. And that said, this has been sort of the moment of a lifetime to really try and make a difference as a public health leader and to bring our school into doing its job of engaging with public health, communicating about public health, being a trusted source of information over a very challenging year. We work closely with Rachel Hurlihi and the governor's office in the modeling effort. Today is one of those days when we'll be talking about what we found in this week's models. We're always hopeful, and I'm hoping that by months in, we'll begin to see the epidemic in Colorado really phase down as vaccination hits home. Just want to make a comment on this terrific partnership with the museum. I think when George and I originally talked about this, we said, yes, this is something we should do together. And here we are as we come not to an end, but at least to a pause. I'm afraid probably there will be some more things to talk about that may bring us back together. That's probably the nature of a fading, hopefully fading pandemic, and it keeps bringing us surprises like variants. So when I wake up, inevitably the pandemic crosses my personal and professional life all throughout the day and the night.
Thank you, John. George, do you have some thoughts?
Yeah, as I think back over the last year, to start with, this partnership has exceeded all expectations. I've never experienced anything like this webinar series with John and his team in the School of Public Health. I'm not prouder of anything else that I've ever done in my life than this. As I think back a year ago, the saddest time was the 100 days we were closed. There's nothing sadder than seeing a museum this big empty for 100 days. Normally we'd have 5,000 to 8,000 people in here, most of them kids. We reopened, we're back to 2,000 to 3,000 people a day. School groups have still not returned. I won't consider it normal until we get the 300,000 school kids coming back through here in school groups. The other aha for me was 3 years ago when we started the Institute for Science and Policy. We took kind of a nerdy, aseptic approach to it, that how can we have science be used more effectively to create good public policy? And as we've learned, especially this last year, that it ain't about the science, it's about the people. And that's who we're here to serve. And I think we've gained a new appreciation of how important science is to us as people, how it affects us, how we affect each other. I'm, after listening to Bobby and Rachel and Cerise and Tracy, I'm hopeful that we have more empathy for each other today than we did a year ago. I think that we see each other as individuals and as humans now, and not as a certain race or a certain class or a certain political party. And I'm hopeful that, that this series have made a little contribution to that.
Thank you for that. Just a couple more minutes here before I want to wrap us up officially. John and George, both of you, any sort of, what's your big silver lining through all of this? What's been keeping you going, and what are you looking forward to here coming up in the next few months?
Well, I will say that if you had asked me a year ago, would we be sitting in April of 2021 with falling epidemic curves, vaccination rates going up quickly, vaccines that work, I could not have imagined that scenario. So if I look to a big, wonderful surprise for all of us, I think it is that one. And then that said, there's so much to be done. I mean, you know, we have great vaccination rates in Colorado. We can achieve things in the United States. There is the rest of the world. And, you know, for example, sub-Saharan Africa, where I still work, vaccines are not yet arriving in most countries. And so I think we can feel good about what we've done, and really in the spirit of equity, when everyone is vaccinated and has access to vaccines that work. So I'm looking forward to that. So perhaps we're winding down a bit here in Colorado, but there is still the rest of the world that we need to turn our attention to.
Absolutely.
Yes, I look forward. I think we've obviously learned that we have a lot more resilience, as Tracy indicated. And the way we do things will probably never go back to the way they were. I think the business model of working from home will continue to stick with us for some people. I am worried about our educational system. We have a generation of kids now that have essentially lost a year of education in many ways. And I think we're going to reevaluate how we educate our kids, and hopefully we'll be able to do it better in the future. But, and this issue of trust, I think that institutions like the School of Public Health and the museum and the Institute have indicated that we are trustworthy, and we have to continue to live up to that.
Thank you. Thank you both. Thank you to our audience. I want to invite all of our guests today. Bobby had to leave us, but we still have our other speakers. We have my colleagues on here, Trent and Nicole. We have some other museum colleagues joining us as well too. I will say, it takes a village, as anyone knows, to put one of these on. There are so many people across the museum that have been involved in this. But I also wanted to bring on a few faces here to just thank you as our audience for joining us for this series. Thank you for joining us today. As we close out, we also want to acknowledge and celebrate that it is National Public Health Week, and recognize all of those that have worked very tirelessly to keep us informed, to keep us safe, to keep us healthy, to provide information to our policymakers and the public about this pandemic. So huge thank you to all of our frontline workers and those in the public health field, as well as so many others. Thank you all for joining us today. Stay safe, stay well, find your moments of joy, and please keep in touch with us. Thank you all.
Thank you.
Thank you.
Thank you.
Thank you.
All.